Good morning, everyone. This is Andy Marrero with Western Marketing. Just wanted to welcome everyone for this new chapter of Western Marketing. Today we have with us Marlene Ortero with Business Development Manager from Agility. Is the company that we are partnering to bring this exciting ACA to all our agents. She's going to be going over the new SEP or Special Enrollment Period, which started February the 15th. It goes all the way to May 15th. And then we're going to go over what carriers you are able to get contracted with. Without further ado, we have Marlene. How are you doing?
Thanks, thanks, Sandy. Thank you for that. Super excited, honestly, to be able to work with you guys. I know you guys have some really great agents. You guys are all over the place in here in the States, so that's always a good thing. We definitely always like to continue to add more agents to the mix. We'll go over today specifically, the onboarding process, carrier availability, which I really, really want to hear some feedback from your team as well, in some of these other states, what companies you guys are hearing that are more competitive that, we may need to add to the board if we don't already. Most of the companies we work with, guys, are all going to be the national carriers. For some of you guys that are in some of these other states that have you know, um, more local insurance companies, we may be a little bit more difficult to get. Not that it's impossible, but what you'll see today in this presentation are the big national carriers, the ones that are available in multiple states, well-known, recognized companies. And that's really what we see a lot of the clients that are enrolling in an ACA health plan sometimes will go and lean towards. The other thing that we notice from clients a lot, and for you guys that are already selling ACA, and for you newbies, this will be something you'll experience. But you have two types of clients out there when it comes to ACA health insurance. You got your first type, which is your one that's going to ask you 1,000 questions, and they're going to want the best network, and they don't care what the price looks like, right? But then 80% of those other people are going to ask you, and this is the important part, I just want the cheapest thing out there, right? And I don't want to spend anything. I want a $0 plan. And if they qualify for it, great. And so there's those two types of people. And that's why when I say, when you look at an insurance company and you say, well, I've heard negative things about Molina Healthcare or Better Health or whichever company, right? You've heard negative comments about it or their network or their customer service. At the end of the day, you guys have to think about it as you still need to add it to your board as a carrier, because in some states, for example, Texas, there's only 5 ACA companies, right? So your clients in certain areas, right? In certain areas, there's only actually 4. So people have to make the decision of going with one specific company or not having health insurance at all. For all of you newbies that may not be aware of this, so back when Obama passed the law of the Affordable Care Act, right, it was mandated to have health coverage. Now, right now, in today's date, it's no longer mandated, which means that a lot of people are hesitant about getting into a health plan just because of well, it's not mandated. At the end of the day, if I don't get a tax credit, then it's going to be off the roof. Here's the other part to that with your clients, that you're going to have clients that are going to come back and say, well, I was penalized even though it's not mandated anymore. I was still penalized when I filed my taxes. So some people have that kind of bad taste about it, right? The reason why they were still penalized when they filed their taxes, and this is something that they probably won't be upfront about it, or two, the agent that assisted them the year prior may have done not a great job of assisting the client to its best needs. And so just enrolled him and put whatever numbers in the system. Um, so if you aren't truthful or you exaggerate your income or the people in your household, what ends up happening is you can qualify for a larger tax credit right? And so then you get that $0 plan because you got a tax credit for the plan that you got. It's a $0. Awesome. You're happy, right? Your client's happy. But what happens is when they go file their taxes, if that income doesn't match or there's a significant difference, then the IRS comes back and says, wait a minute, you didn't deserve that tax credit and it's going to take it back. So some clients, and we've seen this a lot in the last 10 years, we've seen it where it's turned into it's sometimes not even the client's fault, it's the agent that's going in there. And I'm not saying it's you guys specifically, because I know probably you guys don't have heard this, but there are agents out there that will go in there and just so that they can get a $0 premium for a client, they'll put in there they make $20,000 when in reality they're making 50, right? That's a big difference. So some people have a little bit of a bad taste. So, when you see some clients approach you about that, I mean, you just have to tell them, hey, I'm going to do my job. I'm going to try to get you the best tax credit I can within the lines. And we'll go over those things with you guys specifically. So, ACA 101, getting started. What is the Affordable Care Act? For all of you guys that are brand new, basically it's the law that was passed back in 2010 by President Barack Obama, allowing everybody to get enrolled into a health insurance plan. So if we rewind back to before 2000, well, back in 2010, what was happening was people were having to go through underwriting, right, to get into a health insurance plan. So when you were going through underwriting, if you were overweight, if you had any pre-existing conditions, if there was anything there, right, that when you went under underwriting, that wasn't, excellent condition, basically you were denied a health insurance plan or the premiums were off the roof. When the Affordable Care Act passed, what happened is it allowed everybody to get enrolled into a health insurance plan, no questions asked. So you could have cancer, you could have had a heart attack, you could be overweight, and you could still qualify into a health insurance plan. Now, it did have some flaws, right? Because everybody had to get a health insurance plan, so it was mandated. And so what happened was, well, if you made above that 250% federal poverty level, or sorry, 400% of the federal poverty level, then what happened is you didn't qualify for a tax credit. So if you were a family of four and you were mandated to get health coverage, you were having to pay eight, nine to $1,000 for a simple bronze plan. So there were some flaws to it, right? The other thing was, or pay 2.5% of you were taxed the 2.5% if you didn't get health coverage. So for the families that were middle to low income, right, that fell under that 250% or below threshold, what happened is those people were eligible to get that tax credit. And for them, maybe something that was maybe impossible to do before because they just didn't have the income to get a health coverage plan, or they had those pre-existing conditions or underwriting would decline them, those people were now eligible for a health coverage, and at a lower cost, which allowed people to get enrolled, and it made some people happy. So you have your mixture there. The Affordable Health Insurance Plan is available for more people. The law provides consumers with subsidies. We talked about that. Like I said, if it's 400% of that federal poverty level, those people, you have to be between that percentage to qualify for the tax credit. And we do have what's known as a FPL chart. We usually provide that to all of our agents, and I'll make sure to get that over to Sandy in Western Marketing so you guys can have it. But that federal poverty level chart, what it's going to do is it's going to facilitate when you guys are talking to your clients. Because if they fall above a certain amount, you can say, listen, you're not going to qualify for a tax credit. I can quote you, but you're going to pay the full price. And if it's based on their age, it might be really high up there, the price. Or you can say, oh, yeah, definitely you're going to qualify and you're going to get a really sweet deal because it's below this amount. And I'll go over those things with you guys. Expand the other thing that you're going to see is some states expanded their Medicaid programs, so that's big too. With the Affordable Care Act, what happened is that some states went out there and they expanded the Medicaid program. So what it did is it allowed more people to be able to qualify for a marketplace plan. Now there are still a you'll see in the states, like for example Texas did not expand their Medicaid program. So here in Texas what happens is there are people that make too much money, too little money to qualify for a marketplace plan, but they make too much money to go to the state for their Medicaid program. So then there's that little gray line there where that person unfortunately doesn't qualify for a marketplace plan, but at the same time doesn't qualify for Medicaid. So where does that person go? Texas has that issue. There's a couple of other states that will have that they didn't expand their Medicaid program, but there are a lot of other states that have. Um, Open enrollment, it's been now adjusted. It's November 1st through December 15th, which means that anybody can sign up for a health insurance plan, no questions asked, from November 1st through December 15th. And let me be clear on the no questions asked, because I always get that. What it means is no questions asked for pre-existing conditions. They'll still get asked all their questions. They have to be legal residents to the U.S. They have to have a social security number. But the open enrollment starts November 1st through December 15th. Now, once December 15th hits, then they close it down, and then you only qualify if you have a special enrollment. And a special enrollment has to be something that impacted a life-changing thing that occurred that impacted your life. And so that's why you're now seeking coverage. So there's a few different things that we can that are considered a special enrollment. You know, if you moved to a new home, if you got divorced, or somebody in your family passed away, which is within your application, if you had a baby, if you adopted a child, things like that will allow that special enrollment. If you had a income change or no longer working at your job, we saw a lot of special enrollments in 2020 specifically, just because there were so many, because of COVID, there were so many companies that were closing down. And so people were having to go in through their Cobra, and when they go into Cobra, what happens is they have to pay that full amount, right? Because they lose that contribution through the employer. So some people were saying, "Yep, that I'm not going to do that." So they were going into a marketplace plan for the first time. We saw that a lot. That's a special enrollment there. Um, Note to self on this: the way you guys have to think about a special enrollment is just something that impacted your life that made you lose coverage, or you now have to seek better coverage. Just because you decide to move in February, but you never had health coverage before, that doesn't count as a special enrollment. That's just you moved, but you never had health insurance to begin with. So the special enrollment, you actually have to have had coverage. And like I said, you lost coverage within it's 60 days. You've lost coverage within 60 days, or something impacted your life, or you lost the coverage, or you're going to lose coverage, or you're going to seek new coverage. So just make sure you guys know that. As you guys all know, the new President Biden, came in, and what he did is he opened up a special enrollment specifically for COVID. And this is huge for all of you new agents, for any experienced seasoned agents. This is just a little bit of a cherry on top, right? Because you guys get to keep writing more business. But basically, what it is from February 15th all the way through May, you're going to be able to enroll someone. It's almost like an open enrollment, right? Because you just have to have been affected by COVID. And when you think about it, right, everybody's been affected by COVID in some way or another. Everybody's been affected, right? If it's because, now I can't go to the grocery store without wearing a mask, that I'm affected by that, right? Just because I can't, in some states, I was down in California, what was it, last month, and everything was closed down. Everything. I mean, the only thing that you were being able to do was, um, carry out. That's it, right? So some of those things, and you go to the grocery store and it's limited, right? You can't take certain amount of, toilet paper. You only can take one pack, things like that. I mean, it's anything that you've been affected with. So they've made it basically where it's another open enrollment. So you guys have the perfect opportunity right now to, one, get contracted with some of these insurance companies, and then two, start selling as soon as you get contracted. And so right now, contracting is taking anywhere between 5, I want to say some companies come back in 3 days. It's 3 to 5 days where you'll go active. During the open enrollment season in October, when everybody starts ramping up, some people will tell you guys it could take up to 30 days. So for us to have turnarounds right now where someone completes a contract with the insurance company and is ready to go in 3 to 5 days, that is exceptional. So if you guys, are wanting to take this leap and move into the ACA market, this is definitely the time to do so. So carriers that we see that are the most popular, we have Ambetter Health. Ambetter Health right now is in multiple states. You'll see it very popular, Florida, Georgia. You'll see it in Texas that it's really big. Arizona is another state that it's really good in. Molina Healthcare, same thing. You have it in Texas, Florida, and like I said, I'll have a map for this for you guys as we start talking about the insurance companies. But they're in multiple places. We have Oscar Health, Blue Cross and Blue Shield of Texas, guys. Everybody always asks me about the blue. So what happens with Blue Cross and Blue Shield is that unlike Ambetter, Molina, Oscar, and all of these other companies where it's one contract and then you can just kind of add the states to your current appointment or your current contract, Blue Cross is one of those that it's individual by state. So in some states, you'll know it as Blue Cross Blue Shield of Texas. You go into California, you know it as Anthem or Anthem Blue. You go up to Florida and it's Florida Blue. Don't ask me about Florida Blue because we do not carry it. All of the Florida agents will tell you guys Florida Blue makes you captive. So if you get contracted to sell ACA health plans with Florida Blue in Florida, then you can't represent any of the other companies that are in the state of Florida. So, for some agents, depending on where you market yourself, and if Florida Blue is the only option in your market, then I would say definitely it's an investment and just sell that plan in Florida. But if you're in a centralized area like Orlando, Tampa, right, where there's multiple other companies, I would say it's better to have Ambetter, Molina, Oscar, Bright Health in those states, Cigna in those states, than just one company. And that's just my opinion on it. But like I said, we don't carry Florida Blue. Blue Cross Blue Shield of Texas, we have it in every HCSC state, which means it's in Oklahoma, New Mexico, Montana, and Illinois. It's not on here, but like I said, Anthem, we do carry it. It's going to be only for the states like California, Kentucky, Georgia. It's anywhere where you see the Anthem logo on. Friday Health Plans, for some of you guys, you probably saw it. Friday Health came in for the first time into Texas. They're in Nevada, Colorado. So they're in a couple different states now. You got your Scott and White Health Plans. That's just the Texas one, guys, but it's very popular here in Texas because they are affiliated with, if you guys are from Texas or you know people in Texas, if you mention the Baylor Scott Network, I mean, everybody's like, that's the place to be. That's the hospital. If you get in a car accident, that's where I want to be taken. That's just the way it is. Then you got your Medica, which you're going to see Medica mostly in the East Coast. You're going to see a lot of plans with Medica, Bright Health, and then Cigna. For some of you guys that may be asking yourselves, and I'll answer this question now because I know some of you guys are probably thinking this, is if you guys have, a lot of these companies have sister partners or they're affiliated on the Medicare side. The good thing about this is that most of these companies split their contracts. So you have your under 65 and then you got your over 65, right? So there's a way that if you have, for example, Ambetter, right? We all know that Ambetter's sister partner for Medicare was Allwell last year, right? But Allwell bought out, or Ambetter, Centene, the big company, right? Centene that owns Allwell and Ambetter bought out WellCare, and so now it's known as just WellCare. But WellCare is a different different appointment than Ambetter, even though they fall under the Centene logo. So some of those things are going to happen. Same thing for Molina, Oscar. They're all separate contracts. So if you're contracted for the Medicare side, it's not going to impact you on the ACA side, because now we just have to send you guys the contracts for the ACA. And there's a couple, I'll send this out to you guys. I'll send it out to Sandy so that she can distribute this. But there are those states availability for each one of these. Now, Ambetter Health, and the reason I have it here is because in Ambetter, it's going to be known, you guys are going to know it as a different, under a different name. So in California, you know it as HealthNet, right? New York, you'll know it as Fidelis Care. It's still part of Ambetter, but just the name is different. Florida, it's known as Ambetter Sunshine. Here in Texas, it's known as Superior Health, Ambetter Superior Health. So it just has different names, but it still falls under the same logo of Ambetter. Same thing for Molina Healthcare. And like I said, I'll have those broken down. I think I've already sent the breakdown list to Sandy. But if you guys have questions, if there's a company in a specific state, we can definitely look into it. So there's a couple different things on there. Oscar Health specifically, guys, and the reason I broke this down is, remember, it's by it just because the carrier is in a state doesn't mean that it's going to be available in every county. So we have to make sure also, if you get contracted in Texas, right, and you're selling in Lubbock, right? Lubbock, Texas. For all of you guys that don't know where Lubbock, Texas is, on the north side of Texas. Well, northwest, northwest side of Texas. Um, so what happens is that you won't see some of the carrier availabilities there. So Oscar is only available in Austin, Dallas, El Paso, Houston, San Antonio. Same thing for all of these other companies. They're going to be available in that state, but they are going to be available only in certain counties. Oscar likes to affiliate themselves only in the big metroplex areas. So that's the reason I have it broken down that way. And so for you guys, same thing. We just have to make sure that when we're sending you guys these contracts, or you're requesting these specific companies, make sure that they're in areas that you guys market yourselves. Blue Cross, like I said, that is one for Blue Cross and Blue Shield of Texas. Obviously, that one's a big one. It's available in every county. You'll see Blue Cross Blue Shield of Oklahoma as well, Illinois. I mean, you're going to find it everywhere for these HCSC states. As we go in, first thing, like I said, I talked about the carriers, because you guys have to make sure that you guys get contracted with each one of these insurance companies. It's super important to get contracted, because what we see a lot that happens is the agent will go straight into the quoting and enrollment engine, which we are partnered with Health Sherpa, right? And they'll go straight into the quoting and enrollment engine, and they'll start quoting, they'll start enrolling their clients. And then once commissions are released, they'll start calling us, or they'll start calling the agency they're affiliated with, saying, where are my commissions? I enrolled 150 members. And when we look at it, we go back and we go, well, you're not contracted with the insurance company. Worst thing we can tell an agent, because then it's like they worked right to get those 150 members, and we're having to tell them, nope, you're not getting a dime. So make sure you guys are following those steps. For all of you new agents, you got to get contracted first with the insurance companies that you guys are wanting to represent. And then we'll move on to step 2, which is the FFM training. For all of you seasoned agents, you guys know this already. You got to get contracted first, and then you move on to Health Sherpa. Step 2, after you get contracted, is you have to complete what's known as your FFM training. And the reason I'm going to mention FFM training is because FFM training is available in 34 different states. Think about it this way. Anywhere where you can enroll a client through healthcare.gov, then you have to be certified through the federal facilitated marketplace. You have to be certified to get compensated. So you can get contracted, but if you're not certified, you don't get commissions. So you got to get contracted and certified. Those are the two things, big requirements. Now, like I said, they're in 34 states. You're going to find states like in California, they have Covered California. So in California, it's a state-based exchange, which means that they have their own system, right? They don't go through healthcare.gov like everybody else in the other 34 states. What they'll do is they go through Covered California, and there's a different certification. Washington is just like that. New York is just like that. Nevada and Pennsylvania are two new states that became state-based exchange, which means that they have their own certifications and their own platforms that they help enroll their clients in. Now, these other states obviously want to be different. They want to do it their own different way. They have their own platforms. They don't go through a generic healthcare.gov. But the key on this is that for some of you agents, you know how I mentioned the open enrollment is November 1st through December 15th? For some of these states, for example, California. For me, California is my home state, right? That's where I lived most of my life. In California, their open enrollment goes all the way through January 31st. So you get an extra 45 days of open enrollment in California. So sometimes it's a good thing. Sometimes if you're a non-resident to California and you don't really market yourself in there, I would say, yeah, if you're not familiar with it and you're going to go out there and you're just going to find, onesie person that you're going to enroll, sometimes just refer it out to someone. But if you market yourself in that state and you know you're going to have a ton of enrollments coming in from there, then I would say go for it and do the additional trainings. It is worth it. So like I said, you do have to complete certifications. I'll focus today specifically on the FFM states, just because if we go into the state-based ones, each one is different. We'd be here for hours talking about each individual state, but I can always give you guys that information if requested by individual states. So first thing, completing your broker training, you have to go through CMS. So portal.cms.gov, that's the place to go. You have to register. You do an identity proofing. Make sure your national producer number is correct on there. And the reason I'm going to say this is because once we get into Health Sherpa, it's going to ask you for your national producer number. And it's going to ask you for some information that you did when you completed your training. And so that's going to activate that for you. So just make sure you put all of your correct information. We do have steps for this that you guys can use, and we can always walk you guys through this stuff to make sure that you guys complete it correctly and it's done so that you are compensated before you start enrolling your clients. Agents and brokers, like I said, they must complete marketplace registrations annually. This is important, guys, because sometimes we'll see agents that will go in there and say, well, I completed my FFM training last year. You have to complete it. Think about it this way, because you guys do a ton of Medicare. Think about it this way. You have to complete your training, your AHIP and carrier certifications every year. ACA is a lot easier because there's only one certification for those 36 states, right? It's free. You don't have to pay for it. And then the second part is there is no individual carrier certifications. It's just one. So that makes it easier for all of us. Like I said, you will have to make sure that you've completed your FFM training correctly. We do pull those reports through the agent broker registration completion list. So and this is the insurance companies as well. So if your name, or not your name, but if your NPN does not show up on the registration completion list, then something's missing, right? And you have to go back and look in there, because the insurance companies are not going to just take your certificate, a screenshot of your certificate. They actually pull it from the records from that registration completion list. So you have to show up on there. Agents and brokers' national producer numbers must be confirmed. So we have to make sure that you guys have active licenses. Most insurance companies only work with, your general life and health licenses. Temporary licenses, guys, if you have maybe like call centers or agencies that have, internal agents, and you guys may have them as temporary, those are accepted as long as they have a national producer number and they complete the certifications. Agents and brokers who do not complete the registration, obviously we know they're not going to be compensated if they go out there and make sales. It just won't link to the agent. Or in some cases, Ambetter's a little mean about this. They'll go in there and then they'll put a section where it says commission eligibility. No, 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 no. So you see all of your clients, you're like, but they're in there, but you're not eligible. So at least the other carriers don't even put it in there. So just make sure that you guys are going in here and you guys make sure that you complete your certifications. CMS offers agent broker marketplace training at no cost. Like I said, it's completely free, so it doesn't cost you anything to get started in the ACA markets. And when you think about it, for all of you guys that are selling Medicare, you guys know that you guys did a ton of training, right? You guys had to do that AHIP. Got to make sure, fingers crossed, for any newbies that got into AHIP, or if you guys remember your first time you did AHIP, you're like, oh dear God, there's only 3 opportunities to pass this test. Got to make sure that I pay attention. And if you failed the first time, right? I remember 10 years ago when I did my first AHIP, and you fail the first one, and you're like, oh my God, I only have 2 chances left. So it's a little bit nerve wracking. The good thing about this on this side is, one, you're going into the ACA market and you're not having to put money up front, right? The second part to it is, unlike Medicare on this side, the under 65 market is just a lot bigger, right? There's more people to enroll, there's more opportunities. The other part about this is those rules and regulations of the do's and don'ts for Medicare go out the window when it comes to ACA. For ACA, there's no do's and don'ts. I mean, reality is I call it the wild, wild west when it comes to ACA. You go out there and you can market yourself anywhere. There's nothing that you can say where it's going to come back. I mean, unless we're talking like actual summary of benefits and you're giving people the wrong information about what their benefits are going to be. But when it comes to marketing yourself, there really isn't nothing that you cannot do or say, right? You can put it on your social media pages. You can put radio ads, TV ads, and it doesn't actually have to be approved by CMS. So you'll see a lot of people target the ACA during November through December 15th, and even now very strongly, because they're trying to capture that audience. There's, like I said, individual curriculums that include, when you complete your FFM training, that talks about the Affordable Care Act, marketplace basics, how you enroll a client. It does have different scenarios for you of different clients. It also talks about how to understand a client's eligibility and enrollment. So when a client gets enrolled into a health insurance plan through the marketplace or through the Affordable Care Act, what ends up happening is that they get an eligibility letter that states what they were eligible for, what tax credit are they receiving, right? So it helps you understand that. It also talks about privacy standards and information security, right? We got to make sure that when we're talking to our clients, we are giving them the right information. We never want to lie to a client about their benefits. And I think that's just an obvious, for all insurance companies. Also talks about information for security purposes. You guys are going to have a ton of information that's personal details to this client through our quoting and enrollment engine through Health Sherpa, right? It captures a lot of those details. So just how to keep that information secure. So there's the good thing about this is that the other part is, and I think AHIP now does this too, but for ACA, the training for the federal facilitated marketplace training, you have a section with new agents. New agents, prepare yourselves. It's 14 modules long, and you have to do the training. Normally, I see agents knock it out in anywhere from 4 to 6 hours for brand newbies. Um, for returning agents, it is only 6 modules, and reality is it's only really 4 because 3 of them are just like attestations that you read the training, right? That you read the PowerPoints. So it's a lot shorter your second year around. And I've seen some agents knock that out in less than an hour for returning agents. So they make it a lot easier because it basically just talks about the any new updates to the Affordable Care Act, any new updates to the marketplace. It will have those discussions. So you'll see what's the returning agents. That's for anybody that's done FFM training in the past. And then you have your new agents, which you guys have to start from scratch, all the way from the beginning. Now, there are going to be additional vendors, like external vendors. So if you guys do your AHIP, I know that AHIP, their system now offers a marketplace, like you can do an add-on. And in some cases, it will charge you an additional fee. Or even when you go through portal.cms.gov, guys, sometimes it's going to give you an additional, like a additional option, and then it's going to charge you a fee. The reason it charges you that fee, guys, is because it's also giving you CE credits. So that's super important for those CE credits. If you guys are looking for them, you guys are more than welcome to pay for it. But if you don't have to pay for the ACA, don't do it. For the FFM training, there's no need to pay a fee when it's completely free to you guys. Now we talk about Health Sherpa. So Health Sherpa is our quoting and enrollment platform for marketplace plans that go through healthcare.gov. Like I said, what are the benefits of using Health Sherpa? And guys, I'm going to give you guys this code no longer works. I'm going to give you guys, or Western Marketing is going to give you guys a code. So ignore the code on there. But what the benefits are of using Health Sherpa is no more redirects to healthcare.gov, right? No more waiting rooms, no more three-way calls to CMS. I know everybody's muted, but some of you guys that may have done ACA back 6 years ago, or before that, probably have not a good taste on ACA, and there's a reason why you focused yourself maybe more in Medicare, because it was a better it was just a better option at that time, because 6 years ago, before Health Sherpa came around, what was happening is, one, for all of you that remember this process, but this was before, like I said, 6 years ago, you sat down with your client, right? And then you had to create an email for your client. Sorry, you had to create a healthcare.gov profile for your client. And in that profile, when you created it, you had 2 things you had to do. One is they had to have an email address. And then that shocked everyone, because what happened was a lot of people don't have email addresses, or they don't use their email. So we were having to sit there and create emails for these clients, right? Or we had to figure out what their password was to access their email, and then they didn't remember what their passwords were, and so we're sitting there for 30 minutes trying to figure that out. Once we got that done, it would send a verification where they had to verify their identity. And if they missed one question on that identification, then they were having to call to verify their identity. And we were on hold for another 10-15 minutes. By the time we actually got to the quoting part of the application, or the enrollment, I mean, we're already an hour in, right? And then we went through everything, we put all the information down, and then they said, this person doesn't qualify for a tax credit, so it's going to be, I don't know, $850, right? And the client's like, yeah, that's too expensive, I'm not doing that. And you're like, well, I just gave an hour of my time, and now he's not enrolling. Great, not worth it, right? Or my favorite was they got enrolled into the health insurance plan, but then they had to go and verify their income or verify their citizenship, and then they didn't submit that paperwork. And what happened was, once again, yeah, you got paid for 2 months of commissions, but on the third month, right, the marketplace went back and said, well, we didn't receive this information, so we're taking the tax credit away, and now the client has to pay that full amount, and then the client just didn't pay for it anymore because that's too expensive. And so you only got 2 months, and the commissions back then were what, like, I don't know, $15 per member per month or something like that. So you made $30, but you spent, an hour and a half, 2 hours with that client, right? Was it worth it? Not really. So there's a lot of bad taste to it. With Health Sherpa now, what happens is you can actually quote and enroll your client. You quote them first before you even get to the enrollment application. The other part is that it does a agent, it's called a broker portal towards healthcare.gov. So you don't have to create any more personal profiles for each client. There's no more identity proofing for the client because you, as the agent, can verify who you're speaking to. So they don't have to answer those questions anymore to verify their identity. Makes it so much easier. It avoids all of those headaches, right? Everybody remember the 3 years ago, healthcare.gov would always crash, right? Every time on the 14th and the 15th, the last 2 days of open enrollment, it would crash. So we would have to sit there, and I used to call it the endless circle, right? Because it was just spinning, 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 and the enrollment wouldn't get submitted, and then it throw you out, and you'd have to start all over again. With Health Sherpa, it does what's called the enhanced direct enrollment, which means that they submit the information, you just fill in all the data, they push it through. If it comes back kicked that it didn't go through, they'll resubmit it again because they have the information captured. So we don't have headaches with that anymore. Having to call the marketplace, good luck calling the marketplace. If you actually had to make a phone call on the 13th, 14th, or the 15th, you are on hold for up to 2 hours just for a representative to get a hold of you. So Health Sherpa avoids those things. It makes the process so much faster and smoother. For all of you guys that have large volumes of production or are going to be having large volume of production, there's bulk email marketing, which means that you can send out an email to all of your clients that have an email, basically telling them, renewals are coming up. If you have questions, contact me or simply click this link to renew your plan. There's a branded enrollment site for you guys. So if you guys have a website, you guys want to put it on your social media page, you guys can actually put your guys' links on. There's a link. It's called like a referral link. And what happens is, or a marketing link, sorry, it's a marketing link. What happens is if a client presses that marketing link from your Facebook page or your Twitter, or Instagram, wherever you post this, and they click on it, they do a quote and they like the quote and they submit the enrollment, as long as they use that link, it's tied to your national producer number, so you're getting credited. That's why we see, right? Sometimes we get a little annoyed because we'll see it on our Facebook page or our Instagram or Twitter, where it's like all of these people are selling health insurance, and it's like link after link after link, and you're like, oh, come on, right? But there's people out there. I mean, for us, because we're insurance agents, to us, it's like, oh, here's another one, here's another one. But for a consumer that's looking for health coverage, that's something that's catchy to them, right? They're going to click on that link and they can run through that quote and they can submit the enrollment. If you have a website, right, and you promote your website, you can embed that link in there and it's going to tie to your national producer number. You can shop and enroll from one site. That's the other good thing about this. It's a one-stop shop. So all of your ACA carriers, as long as you're licensed and certified when getting your account set up, you are going to have access to that you're going to have access to each one of those insurance companies. Now, that quote and enroll, like I said, it scares me sometimes a little bit because you can go in there and if you skipped the step of getting contracted, but you completed your FFM training, right? What happens is you can go into Health Sherpa, set up your account, select all the companies you want. Just because you select them on Health Sherpa's quoting platform does not mean you're contracted with them. It just means you went in there and selected a bunch of carriers. So you can go in there and select all of these companies, but you always have to make sure that you're actually contracted with them. So, like I said, key to that is make sure to get with Western Marketing to make sure that you are contracted with the companies that represent in there. Second part is that quote and enroll. You are going to be getting those eligibility notices for each one of your clients as soon as you submit the enrollment. So, for example, if I submit an enrollment right now for Sandy, right, what happens is that I'm going to get that eligibility letter. I can print it out for them and give it to them or email it to them. And within 7 to 10 business days, they're going to get it mailed to their house as well. So the good thing about this is I can give them information instantly without them having to wait for the marketplace. You can do drug and provider search through here. So that's also a good thing for clients that come in that say, I want to make sure to have, Dr. Smith and Dr. John on my health insurance plan, and I need to be able to cover the following drugs, right? And you're sitting there going, well, I don't know if they're going to cover it or not. Where do I look? The Health Sherpa platform actually lets you do those searches so that when you narrow it down, you can tell them exactly which company is going to be able to cover those things. Manage upload documents for clients. That's also huge, guys, for Health Sherpa, because this was actually something that was added on 2 years ago. This is actually their third year now to upload documents. So before, remember I talked to you guys about having to help your clients out, and then what for if they didn't submit certain documents or they didn't send in, because before you had to mail it out to the marketplace. If you mailed it out and for whatever reason it got lost or your client just didn't mail it at all, what happened was that you guys would the tax credit would be gone, and then all of a sudden it's no longer showing up in your commissions. You're not getting paid anymore. So by having that feature now, where if your client needs to verify their citizenship or needs to verify their income, if they email, fax, or bring them into your office, you can upload them into the system and you get the confirmation from Marketplace that they received it and it's been processed. And that normally takes a few hours for them to process it and verify it. But you have proof that that information was received by the marketplace. So there's no reason, if you're enrolling your clients, because they all qualify for $0 plans, right? And it's always better to have them in a $0 plan because it's not going to fall off the books, and all they have to do is upload those documents. You have to upload those documents, then it's worth for you to be able to upload those and you have a secure enrollment complete. So you can upload all of those things. Like I said, real-time status and notifications. This is new as well, guys. This actually was just released this year for 2020 open enrollment, 2021's open enrollment season. You had now a section in Health Sherpa that talks about marketplace notifications. So if your client calls you and says, I received something from the marketplace, instead of you telling them, read it to me, or can you email it to me or send me a picture, you can go into your Health Sherpa, pull up that client's file, and then you can actually see exactly what the marketplace sent them. And if the marketplace hasn't sent them anything, it's not going to be, that document is not going to be there. So they have that information there. Number 4, make first payment. So it does have the ability to make that first binder payment. It's only going to allow you to do the first binder payment. After that, you can set them up in auto pay, or the client can make their monthly payments and they'll have a list of how to make those payments. But it allows you to make that first binder payment on the website. Report life changes. You guys can continue to use Health Sherpa during the special enrollment. Right now, because of this COVID special enrollment, you guys can use Health Sherpa as your quoting and enrollment engine. In the past, it was only available during open enrollment. Now it's actually available during the special enrollment period as well. The other thing is it's tax season. We all know that. So we get clients that are calling us about their 1095A form For all of you newbies, you guys probably don't know what the 1095A form is, but basically the 1095A form is the document that they have to provide when they file their taxes that shows that they got a tax credit, right? And they had health coverage. So if they got a marketplace plan, that 1095A form gets mailed out to them. If they didn't receive it for whatever reason, you guys as the agents have access to those forms. Good thing about this is you have access to the forms even going back to 2019 and 2018. So if they weren't your clients the year prior, no big deal. If they're your clients this year for 2021, right, then you're going to have access to those forms. And then maintain consumer relationships. It has a cool built-in CRM notes section where you can keep your notes. Mostly if you guys are agency owners with maybe internal people working in your office, you guys can put your notes in there, know who's talking to who, track client activity. And the last feature that's on here, that's not on here, but now they have a thing where you can verify that you continue to be the agent of record. So let's say somebody called Sandy, right? I enrolled Sandy and somebody called him and said, and moved him over, and now some other agent is the agent of record. The system's going to notify me that there was a change, and it's going to say under NPN instead of mine, it's going to show another party. And what that means is somebody stole that client from me. So they just built that feature in this year, which is really, really nice because it's going to help us control better our client list. And you can export those lists so that it's easier for you to manage and see what happened with which clients. Help on demand, that's the last thing, guys. Once you have contracted with the insurance company, and I promise you guys, this is the last slide here. Once you get contracted with the insurance company, you've completed your certifications, you've set up your Health Sherpa account. The fourth step, then we start talking marketing. How are you going to go out there into your community and you're going to market yourself? Western Marketing will always definitely help you guys. We'll help you guys as well with the marketing, printing flyers out, helping you guys build your websites. Help on demand is really, really good. We've seen it very successful with a lot of the agents. Basically, what it means is that when you complete your certifications, there's an additional training that healthcare.gov offers. Now, this is optional. But if you complete the certifications, what happens is that anybody that goes into healthcare.gov, because they're trying to just figure it out themselves, and they get stuck and ask for assistance, instead of them having a marketplace, healthcare.gov employee call them, what happens is it's going to reroute it to an agent that is near them, near their zip code, and speaks their language. So it sends you an email notification, and it only does email notification. It sends you an email notification with the client's information and phone number saying this person is needing assistance. You have 15 minutes to be able to contact that client from the moment that enrollment comes through. This is huge. We see a lot of agents get anywhere from 5 to 6 leads a day. I personally was getting on my help on demand, I was getting 5. My team was closing 3 out of those 5 out. So it's worth it. We'll show you guys how to set up your help on demand because, like I said, it's a different training where you have to go in there because it talks about how to use the system. So it's not. This is optional, but like I said, if you guys are willing to, you guys need leads and you guys are willing to keep an eye on your phones, like I said, it gives you only a 15-minute window to be able to pick up that lead, or it moves on to the next person. It removes it from your system and it just puts it somewhere else. Uh, you guys choose your hours of operation for this system. So if you say, I'm only going to be available from 9 a.m. to 12 p.m., then what happens is it's only going to send you leads from there so that it knows that you're going to be able to pick it up during that time frame. If you put on there from 8 a.m. to 8 p.m. and you get one at 7:50, you got to make sure to make that phone call or you're going to lose it and it's not even worth it. The better that they see that you're picking up these leads and you're closing them out, the more they start sending towards you. If they see that you start missing, then you kind of get put at the end of the list, right? And you're not going to get those leads anymore. So make sure you guys actually put time frames that you guys are actually going to be available. Average ACA commissions right now is $19 per member per month. I averaged it out, guys, but reality is this is based on the open enrollment season because some companies pay $18.75. Some go all the way up to 22. Now, because of the COVID SEP, special enrollment commissions for some companies have increased even more. For example, Ambetter Health in Florida, they're paying $30 per member per month right now for any new enrollments. All of the other states are paying $25 per member per month. So some of these companies have increased their commissions. This is just an average and an example, guys, of what can be possible. So if an agent enrolls two policies each day during the open enrollment, two policies, right? There's 45 days of the open enrollment season. You times that by those two policies, you enrolled 90 policies, right? And you're just doing two a day, 90 policies. Your average policy carries 1.5 members, right? Because you're going to have people that are going to have three people in the applying for coverage. You're going to have some people that are just onesies. So I normally average it at a 1.5. So there's 90 policies times 1.5, which is 135 members enrolled. 135 members times that $19 average, right? That's not the actual amount. This is just an average. Then you're looking at 2,565 every month for the policy year. So for you to go out there and just enroll two people for 45 days, right? You know you're going to be making $2,565 every month as long as the client stays on the books, right, for that policy year. So you know that those are going to be secure commissions for yourself. Within a year, you're making $30,000, and that's just enrolling two policies a day. Some people go out there and enroll, anywhere from 10. If you guys have an agency, maybe you guys have the ability to do 15, right? Anybody that has those PNC shops, a lot of our agents that also have PNC included, what they do is they'll go back and they'll target all of that book of business, right? So if you guys have 400 already active policies for the PNC side, think about it that way. Referrals, all of those things start coming in. So when I talk about two policies each day during the open enrollment, that's the minimum amount, guys. And it's for 45 days. You just have to focus yourself for 45 days. And from there on, it's just really customer service. But most of this, you have to send them back to the carrier, right? Because the carrier is going to provide them information about certain things. It's not like short-term medical where let me walk them through how to file a claim and do all of those things. You may have some of those situations here, but it's not as complex. So that's definitely very doable. And like I said, this is just an average. Our top agents are going out there, and I actually had a few agents this year that reached 25,000 enrollments on their own. Um, Obviously, with the help of, if they have a team, but sorry, 2,500 enrollments. So it's very doable for one person to go out there and reach really high numbers. And we always do have, I'm going to stop here, guys, because we always have upcoming webinars and things like that. You guys are more than welcome to piggy off of our webinars that we have. They're very generic, but if you guys are needing any specific details, always make sure to get with Western Marketing on there. We can always set up meetings, trainings, anything that you guys need. Sandy, if you can open up the questions on here, or the mics, that way if anybody has any questions, we can kind of go from there.
Definitely, definitely. Thank you very much, Marlene. I have several questions that I have been trying to answer throughout the whole process of your webinar. But I'm going to have some questions that I wanted to go over with you, if you can answer it.
Yeah.
First question is, does the IRS comes back for any of the cost sharing reduction too if the income is underreported?
So what happens is this is what I've seen within the last 10 years. So if let's say you have a family that goes out there and they say, well, I'm the only, husband's the only one that works, and he makes $30,000 a year. If when the at the end of the year he made 35,000. That's not a big deal because it's an estimate. But if someone goes in there and says, "Oh, well, my husband's the only one that works," and they put $30,000, and at the end of the year when they go file their taxes, "Oh, guess what? Wife worked as well and she made 30,000 and now it's 60,000." That's where they're going to come back and they're going to be like, "Wait a minute. No, 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 no. Like you got a tax credit that you were not eligible for because you're making 60,000 instead of 30." With
Mhm.
as long as you guys stay within that $5,000 gap, I would say $5,000 more or $5,000 less, the client is fine. But what alerts them is when we start putting really different numbers, right? When it's 30 to 60 or 30 to 50, that's a big increment. Hopefully that
Gotcha.
answers that
Gotcha.
question.
Thank you very much. And then second question is, if someone upload a W-2 and income change, do they need to upload a new W-2?
So they always have to make sure to let the marketplace know of any changes because the tax credit will change. So let's say in the beginning of the in November when you enroll your health insurance for the health insurance plan with a January 1 effective date and you were estimating yourself to make $24,000. I'm going to use that as an example, right? And in June of 2021 you realize, okay, well, I just reached my 24,000 and I think now I'm going to be at least getting 50. We have to upload that and we have to make that change because the tax credit is going to change. And so it will be adjusted to the new income. So always
Um,
make sure any of those changes, we do have to make sure to do those, and that's a special enrollment, right? Income change is going to be a special enrollment. They're going to be able to do those things.
got you. Then there's another question. It says, are these commissions for lifetime or just for the first year?
No, so the commissions, so there are going to be companies like, for example, Ambetter, Oscar Health, Bright Health, Medica. They pay new and renewals the same amounts. And Sandy, you can make that available to the agents for the commission schedules, but they
And I
pay
will.
new and renewals no matter what the amount. Sorry, no matter if it's a new or renewal, the commission stays exactly the same. There's companies, Molina Healthcare is going to be one of those that they pay the renewal
Mhm.
differently. So new enrollments right now in Florida and Texas, I believe they're like 1875 or $20. It's somewhere there. I have to go back and look. But the renewal is paid differently. They'll pay it at $15. So it drops when it's a renewal. But not every
Gotcha.
company does that.
Great. Great. And then finally, I know that we are running out of time here, but I wanted to hit 2 points here. Uh, in uh, uh, in certain Illinois, we only have two companies in the ACA, the Blue Cross and the Health Alliance. Will it be more in Illinois?
So definitely there will be. So there's a few other ones. I want to say, depending on the area, send me the zip code and I'll look. Because I want to say
Hmm.
there's also every year there's new companies that go into the market. So I would just have to verify which other ones are available there. And like I said, this list
And
here that
mhm,
I provided in the beginning. This is just our
mhm.
most popular, guys. These are the most popular ACA because they're nationwide. But if you guys have a specific one, we may have it. It's just that's not one that's going to be found in every state or in multiple states. All of these here are found in multiple states.
Finally, New Jersey. Do we have anything on New Jersey?
So New Jersey's a little bit of a special case. So in New Jersey, we do have Oscar Health in there. But some of the, and we'd have to go back and look at exactly the county because in New Jersey, there are some companies that don't pay commissions. It's like New York. New Jersey and New York, for some reason, there are carriers that just don't pay commissions to the agent for ACA business.
Fair enough. I believe that that answers some of my questions. I will go ahead and one of the answers of for another question was whether or not this companies pay directly to the IMO or FMO. With Western Marketing, most of the agents are going to be paid directly from the carrier,
Yes. Yep. And same case
unless
scenario here.
correct. So that should answer that question. And then Medicaid and CHIP questions is the last question I'm going to ask you. Um, says here, if son is referred to CHIP Medicaid and doesn't hear back, still has no insurance, how to get the son insurance? So if they send it to a CHIP or Medicaid and does not hear back from them, how do you get then an insurer?
Yeah, so that's going to be one of the things. So with Health Sherpa, guys, what it does is when you submit the enrollment, or sorry, when you run the quote, it's going to automatically identify who is eligible and who needs to go to Medicaid or CHIP. So when you go to Medicaid or CHIP, the system at the end of the enrollment is going to send that information. It automatically sends it to the Medicaid office, right? And they'll start that application for the client. Now, for that, if they do not hear within 2 weeks any news from the Medicaid office, they need to call it in because the system, if we want to add someone that is eligible for Medicaid and we say, no, 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 we haven't heard anything, we don't, the system's not going to allow you to enroll the client or the child. It's going to keep kicking him out. So you have to have a letter from the Medicaid office saying that they were denied, and it can't be because they were denied because the parent or the person didn't provide sufficient information or sufficient forms. It has to be because they were declined because of income or a stat. I mean, it's going to show the status of why they were declined. So if the client
Well, that
doesn't hear
answers.
anything within 2 weeks, they have to call the Medicaid office.
All right, great. Well, with that, I would close in. I thank you, everyone, for joining us today. This is a very exciting opportunity for everyone that has not been in this um, system because of previous experiences with the ACA, or because you thought that you did not have the opportunity to make some money. Clearly, you can do way better than what you thought you can. That's why West Marketing is trying to be upfront and get into this system as well. So we are going to be on a learning curve, everyone. So uh, please send us requests for contracting. Once you get set up and complete your training for the FFM, then we will send you a Sherpa link that will allow you to do quotes and get you ready for contracting. Um, and I'm going to be putting together an email to send to everyone with a copy of this webinar that is being recorded. So with that, I want to thank you, Marlene, for all your help. If you have anything else to add before I let you guys go.
No, I think same thing, Sandy. Everybody on this webinar, we're really excited to have everybody on board, and hopefully, like I said, through Western Marketing and us, you guys get that support that you guys need. And feel free, any questions you guys have, let Western Marketing know. Let us know. We're always happy to help. Okay.
Great. Thank you. You have a blessed one.
Thank you. Have a great day, everyone.
Bye.